Welcome. My name is Peter Strong. I'm a professional online psychotherapist specializing in mindfulness therapy, which I offer via Skype for the treatment of anxiety, including panic attacks, and also for other common psychological emotional problems such as depression, OCD, addiction, etc. So I'm often asked, how can I stop anxiety attacks? They're very distressing for people. I'm sure you know this yourself if you're suffering from anxiety attacks. They are quite crippling. They limit you tremendously in what you can do. And the fear of having panic attacks is often so strong that you tend to become more and more isolated, and agoraphobia is a very common endpoint for people who are struggling with chronic panic attacks. So how do we stop these panic attacks? How do we manage anxiety in general? Well, the conventional approach typically will prescribe some kind of anti-anxiety medication, and sometimes talk therapy can be useful, but in my experience these do very little to actually change the underlying mechanism that's causing your anxiety and panic attacks. That's what I try to address in mindfulness therapy. This is a very different approach than conventional talk therapy or counseling. We are trying to find out exactly what goes on in the mind. How do you actually create your anxiety in the mind? What triggers it? And then what happens in the mind? So mindfulness is a way of exploring the mind in detail. I will teach you how to apply mindfulness to overcome your anxiety and panic attacks during our sessions together. But the principles are fairly straightforward and something that really does produce results. So if you really want to get on top of your anxiety and panic attacks, then I invite you to really think about mindfulness therapy. So the first principle is learning to change our relationship to our emotions and thoughts and other content that make up the mind. Now, from a Buddhist point of view, and mindfulness, of course, has its roots in the teachings of the Buddha, we understand that we, in essence, are not the contents of our mind. We are not emotions, we are not thoughts, we are not beliefs, we are not memories, we are not perceptions. Those all constitute what we would call the content of mind, and they are all described as being mental objects. And often we describe the combination of these mental objects as being our personality, our ego, or our little self. That's a term that I use a lot. All of these mental objects are not who you really are. In essence, who you really are is the consciousness that can see these objects. You can be the observer of anything that arises in the mind. And the nature of that observer is quite different than the content of mind. So by changing our relationship to the content of mind, these mental objects, thoughts, emotions, etc., what we're doing is learning how to become the observer, our true self, as I call it. So the true self is not the thoughts and emotions, it's the conscious awareness of the thoughts and emotions. And that is quite different. The basic cause of our suffering is that we lose this objectivity, if you like, and we become identified with the contents of mind. We literally lose our perspective as the observer, and we become contracted into the very small and limited consciousness of thoughts and emotions and other mental objects. We become the object. So this is the primary operating force, if you like, that sustains anxiety and its more severe form as panic attacks. It's when we contract into our anxiety or fear, that's when we ignite this suffering. We feed it by becoming identified with our anxiety. So our job is to change that habit, and that's what it is. It's a habit. It's not a mental disorder, it's a habit. Habits thrive on the absence of consciousness. In mindfulness therapy, we reverse this unconsciousness, we reverse this habit by really applying our conscious awareness to examine the objects of mind, in this case anxiety. We look at it very carefully. We learn how to meditate on the anxiety. In that way you train yourself out of the habit of becoming consumed by the anxiety. You learn how to remain as the observer. So that's the first part of training in mindfulness therapy. We call this developing equanimity, and that is the bedrock of mindfulness training and the bedrock of the process that leads to liberation from suffering like anxiety. So you can think of anxiety as being like a fire, and when we are under the influence of the little self or the habit mind, then that's the equivalent of placing our hand in the fire and suffering the consequences. But when we become identified as our true self, the observer, we can see the cause of our suffering, and we simply respond in a very natural way according to our own internal wisdom, and we take our hand out of the fire, and that leads to the resolution of that suffering. This is the same with anxiety. Anxiety technically is not the problem, it's our relationship to it that's the problem. So we become so identified with it, and then we become so consumed with fear-based reactions to the anxiety, and that basically is what escalates the anxiety into a panic attack. So we learn how to sit with our emotions without becoming identified with them, without becoming reactive to them. We learn to hold them in our awareness, and that is the first essential step for liberation from anxiety and panic attacks. The second step is to explore all of the different parts of the reactive process, all of the thoughts particularly that feed that anxiety. So we learn to see those in the same way as mental objects. We remain as the observer or true self, and the objects are just reduced to being objects. They have no power over you as long as you stay conscious. So we explore all of the reactivity, and in this way we train out of the habit of becoming lost in anxiety-producing thoughts, lost in beliefs, lost in the emotional reactivity that feeds the anxiety. The next stage in our mindfulness training is learning how to heal the anxiety by developing a compassionate relationship towards it. So the first training is in developing equanimity towards the anxiety. The second stage is really about developing compassion towards the anxiety, which we see as an object in pain. So we learn how to heal the anxiety by making friends with it and learning how to comfort it in exactly the same way that you might do with a child. And the good news is you already know how to do that. This is part of your essential nature, your true self. And the essential nature of who you are is incredibly positive, and it is based on love. That is its primary nature, and also based on innate wisdom. These are innate properties of your true self. It's positive by nature, and it's already in existence as part of your being. What we're trying to do here is to awaken to our true self and then bring that true self where it's needed, to the assistance of the little self, the anxiety. So we see the anxiety as being like a child, and then we simply allow our innate wisdom to become active, to produce action that will help heal that inner child. So we work with the anxiety in that way. One of the principal mechanisms by which anxiety heals is by changing its imagery. So we explore the imagery of our emotions during our mindfulness meditation on our anxiety. We look at the imagery of that anxiety. We look at the position of the emotion. Where do we actually see it? Can we move it to a better position where it feels more at ease, where we can comfort the anxiety? It's quite surprising the results you can see when you simply take the emotion and move it. This works extremely well in things like performance anxiety or driving anxiety. You take the anxiety and you move it beside you. Put it in the passenger seat, or put it on the table beside you, or on a chair beside you if you're giving a presentation. Giving it a better position than being stuck in your throat, for example, is very, very productive. So we want to know about this imagery, and that's why we learn how to meditate on our emotions, to see how they actually work, to explore the position of the anxiety that takes that position, of course, out of habit, and then we explore moving it. We might also explore making it smaller, changing its color, changing its temperature. If it feels very hot, can we cool it down? There's all kinds of ways we can interact creatively and skillfully with the imagery of the anxiety to help it heal itself. So we're basically teaching the anxiety how to heal itself by changing its imagery. All of this learning, of course, becomes automatic with time, and the anxiety starts to automatically heal itself once it knows how to do that. So this is all part of mindfulness therapy, and it's what I will teach you in great detail during our Skype therapy sessions together. It's very, very effective, and most people who use the mindfulness approach that I teach see dramatic changes within just a few sessions. So if you'd like to get started with me and you'd like to learn more about the mindfulness approach for healing anxiety and for stopping panic attacks, then please contact me and let's schedule a session. You will see straight away within that first session the power of applying mindfulness skillfully for working with your emotions. So please contact me and let's get started. Thank you.